Good afternoon, ladies and gentlemen. Welcome to this new webinar from the European Menopause and Andropause Society. Our speaker today is Professor Blazej Meczekalski from Poland with the topic Eating Disorders in Older Women. Before to start with the presentation from our speaker today, I would like to remind our attendees that at any time you can leave your questions using the questions function that you will find in your control panel, and at the end of this webinar, our speaker today will kindly answer for that. So now, Professor Meczekalski, when you want, you can start with your presentation.
Okay, thank you, Alberto. Thank you so much. Good morning or good afternoon, everybody, because people are from all over the world. And it's a pleasure to present today's topic, eating disorders in older women. I work in the Department of Gynecological Endocrinology, Poznań University of Medical Sciences in Poznań, Poland, is the west part of Poland, quite close to the border with Germany. I have 300 kilometers to capital of Germany, Berlin, and 300 kilometers to capital of Poland, Warsaw. I also represent Polish Society of Gynecological Endocrinology, and I would like to thank you, Professor, President of European Society of Menopause and Andropause, Professor Irene Lambridunaki, for kind invitation me to present this webinar. And now I can move to our topic. At first, at the beginning, I would like to concentrate few words, few information on the problem of the nutrition, because it's really linked to our topic. We know such sentence that we are what we eat. Maybe we can transverse also a little bit this sentence that we are how we eat. Nutrition has a crucial role for our well-being and also influence our body weight, our appearance, our skin appearance, and generally our health. As we can say, nutrition is very important from the point of view of the pattern of the nutrition. It means, I just mentioned, how we eat. It means how often we eat, which portion we use. If we eat, let's say, quite late during the night or only during the evening. Also is important which items or which nutrients we eat. Of course, this is very important. Another important point is referred regarding nutrition, that nutrition has very important role in each stage of female life, because during this presentation we are focusing on the female life. For instance, nutrition will be very important during the prepubertal time, pubertal time, very important in the reproductive period. We know that for the planning of the pregnancy or later lactation, but also very important significance for premenopausal and postmenopausal women. As we can, because we will concentrate according to the topic of our presentation on the older women or in advanced age women, and we can say that at this age, advanced age, the people or females are more vulnerable for different disorders, for malnutrition, which is related what they eat, female and how they eat, and also they are more susceptible for different non-communicable disease. And this topic, in the sense of the relationships between nutrition and the health, are also very important from the point of view, or from the demographical point of view. Why? Because in our continent, for instance in Europe, we can observe in the majorities of countries that is important increase of the older population. In population, let's say, older than 65 years. According to, as you can see on the slides, WHO report from 2011, it is projected that this population will increase 3 times by 2050 year. Another problem related to this aspect is that longevity is very important, but the quality of longevity may be even important. Everybody, even in the advanced age, would like to live in the good condition. Therefore, there are promotion on some special healthy diet according to the majority of the studies which concentrate of the kind of the optimal nutrition. The Mediterranean model and diet looks like the best in the sense of the positive influence on the mental and physical function in not only females but also in males. For instance, in 2008, Liechtenstein proposed modified pyramid for individuals over 65. And now, after this kind of the important, in my opinion, informations, I would like to focus on the today topic, eating disorders in older women. At first, we need to define it. What does it mean, eating disorders? According to the scientific literature, eating disorders can be characterized as the heterogeneous group of complex psychiatric disorders, because these are classified as the psychiatric disorders, which are characterized by abnormal eating behaviors. And now, what are the features of these eating disorders? For instance, first point, serious disturbances in eating behavior. Second point, extreme and unhealthy reduction of food intake, or not only the reduction of food intake, but also severe overeating. And also the third point is very important because it is referred to feelings of distress or extreme concerns about body shape or weight. Now, if you would like to say other important characterization of eating disorders, we need to stress that generally we need to be aware that these problems affect mainly young people. Young people, it means we think about people because the typical age presentation is between 16 years old, more or less up to 25 years old. This is typical presentation generally for eating disorders. But we can differentiate between different eating disorders. For instance, for anorexia nervosa, the mean age is 17 years old. for female. For bulimia nervosa, mean age is between 18 years old to 25 years old. But we need to remember that this problem also concerns older people or middle-aged people, especially women. Of course, in this group, the eating disorders occur quite rare than in the group of the young women. But, of course, occur. Later I will tell you exactly. And in relation to middle-aged people, we can find two groups of the females. It means females who never recover from adolescence eating problems and these eating disorders in the middle age are the kind of the continuation of the problem who starts when they were young, let's say 22 years old. And second group, when the problem started first time in the middle age. And now some basic informations about classification of eating disorders in general. The classification was prepared by American Psychiatric Association based on the Diagnostic and Statistical Manual of Mental Disorders. And at present, we have the 5th edition of DSM. It was published in 2014, but the first edition, DSM first, was published in 1952. And according to the last edition, DSM 5th, we have 4 categories of eating disorders: anorexia nervosa, bulimia nervosa, binge eating disorders, and other specified feeding and eating disorders. Regarding eating disorders in older women, we need to be aware that among these 4 categories, the predominant category in older women is binge eating disorder. They occur completely more frequent than anorexia nervosa and bulimia nervosa. Another important problem regarding older women is that when we observe last decades, this problem is increasing. Probably, if we will think about it, we can find different reasons or causes of it. In my opinion, such causes like the important increase in the stress generally in the life, in our family, in our work. Another problem are personal relationships. Another problem is specific personality of people who are susceptible for such disorders. And of course, if we diagnose such eating disorders in older women, we can assume that these disorders have very important negative impact on female health. Of course, we can also treat puberty and menopause like a kind of the window of vulnerability for this condition. It can be related to the important hormonal changes during these periods of female life. I think about puberty and menopause. Of course, eating disorders in older women are also linked to the increasing rates of morbidity and mortality. Now, I will make kind of the overview of these 4 categories in older women. I will start from anorexia nervosa. This disorder, like anorexia nervosa, was for the first time described in 17th century by Richard Morton, but the term anorexia nervosa was for the first time used by Sir Dr. William Gall, who was the physician of Queen Victoria in England. Now, regarding anorexia nervosa, it is characterized by decline in appetite, leading to significant loss of body weight. And generally in women, it affects from 0.9 to 2.2% of women over their lifetime. Regarding older women, it occurs completely more rare, because if you can see here on the slide the citation from the Manguet-Macek study from 2014, they studied 715 women aged between 40 to 60, and they found this problem in 0.4% of women. Regarding the etiopathogenesis or pathophysiology, we can consider different aspects, but genetic vulnerability can be related to the background, personal traits in the sense of the perfectionism, neuroticism, and also, as I mentioned before, environmental factors such as stress, social life, and of course, thin body model. Of course, if we will go more profoundly, important changes at the level of the brain in the sense of different neuropeptides and neuromodulators such as serotonin, opioids, and dopamine. Some informations about anorexia nervosa in women, in aging women also. You can see that only 50% of patients will fully recover, and drop out from the treatment in anorectic patient is also quite high, between 20 to 50%. We need to also be aware that quite big percentage of the people with anorexia nervosa, they have comorbidity with other psychiatric disorders such as depression or social phobia. Here is the citation from 2010. We can find information according to Scholz from 2010 that 46% of women aged over 50 diagnosed with anorexia nervosa suffer also from depression. And what is important, the mortality rate is quite high because around 5%. Of course, we need to be aware how important are the long-term consequences of anorexia nervosa. The main consequences are listed here. We have no time to focus on each problem, but only we can make a list in the sense of the cardiovascular problem, pulmonary, neurological, gastrointestinal, dermatological, of course, hormonal, and the big problem is skeletal problem, because you can see that approximately more than 70% of women over 50 years old with anorexia nervosa, they have osteoporosis. If you can see, very significant number. Regarding to the treatment of anorexia nervosa in aging women, this is the real problem, because it is really difficult to treat these disorders in aging women. Generally, according to the clinical study, the duration and intensity of the therapy should be double in older patients. Very important is the participation of the family in the treatment, or in other words, family support. Because here we can see below the 3 types of the treatment: psychotherapy, nutritional rehabilitation, and pharmacotherapy. Not only in my opinion, but according to the literature, the psychotherapy, mainly the cognitive behavioral therapy, is the best way to treat this patient. Pharmacotherapy should be limited to the short-time use. Another problem, apart from anorexia nervosa in aging women, is anorexia of aging. It's something like this that can be defined as the age-related reduction in the energy. Anorexia of aging. We know that in this aging woman is the real problem with the appetite, food intake. It has a lot of determinations, let's say some different neuropeptides, neurostimuli, such as neuropeptide Y, ghrelin, and others can change at the in the aging population. Problems with the emptying of the stomach also is important. Another problem is also related to the specific social situation of the aging females, like living alone, problems family, stress, depression. And this anorexia of aging has important impact on such problems like loss of muscle tissue, which is characterized as sarcopenia, decreased bone mass, reduced cognitive functions, increased hospital admissions, and also immunological problems. I just mentioned about these determinations, as you can see in the slides. Here I would like to stress that for anorexia of aging, social isolation, depression, and poverty may really contribute to the diminished food intake. Regarding the treatment, you can see how important it has influence on the morbidity and mortality. Kind of the essence of this problem is that the prevalence of malnutrition among hospitalized patients, I'm talking this patient in the advanced age, is 30%, the highest incidence in geriatric patients. Now, some information about bulimia nervosa. Bulimia nervosa is defined as recurrent binge eating followed by compensatory behavior such as purging. You can have here the information how this purging can be done by self-induced vomiting, excessive use of laxatives, excessive exercise, or fasting and over-exercise. The most affected group is between 16 and 29 years old, but for the information how often it can occur in middle-aged people between 40 to 60 years old, bulimia nervosa occurs in 0.2% of these females. And the lifetime risk of bulimia nervosa in women aged 45 is similar, 0.2%. Causes are similar like anorexia nervosa, generally related to the stress and specific personality. Psychotherapy has the main role. Another problem, binge eating disorders. they are characterized as the binge eating at least 2 or 3 times a week without compensatory behavior, along with feelings of shame and guilt after overeating. This is very important because, as I mentioned before, these binge eating disorders in older women are more common than bulimia nervosa or anorexia nervosa. In relation to the etiology, this etiology, similarly to anorexia nervosa, is multifactorial, related to the genetic background, acquired factors, we can see here which factors, and also personality. The lifetime, generally, if we talk about binge eating disorders, the lifetime prevalence is between 1 to 3%. And as I mentioned before, they are most prevalent in older age. The prevalence, as you can see on the slide, among women older than 45 years is estimated 0.6%. And similarly to, for instance, anorexia nervosa, it can be the continuation of disease starting from the young age or starting the problems at the middle age. Here you can see, according to the very nice study which was made in 2007 by Marcus and co-workers, we can see here how often it occurred in the group of the studied women, independence of the age. For instance, the higher percentage of binge eating disorders, 11%, occur in women at the age between 42 to 55. And generally, the conclusion of this study was that the prevalence of binge eating disorders is higher in perimenopausal women than postmenopausal women. The problem and the differentiating factor is that in this group of the women is binge eating, but without the compensation, like in bulimia nervosa. And therefore, it has the negative influence in the sense of the obesity, dyslipidemia, and insulin resistant and hypertension. Therefore, the course of this disease in these women we can compare to the vicious cycle, because after this overeating, binge eating, we have obesity. Later we have the problems with the depressive mood, and later depressive mood also can stimulate binge eating. Also, the 4 categories is other specified feeding or eating disorders. Which disorders can we classify to this last group? At first, these disorders which do not meet full DSM-5 criteria for anorexia nervosa, for bulimia nervosa, or binge eating disorders. And here we have examples with which eating disorder can be classified to this last group. For instance, atypical anorexia nervosa, where all the criteria for anorexia nervosa are met except underweight, despite substantial weight loss. Another, atypical bulimia nervosa, where all the criteria for bulimia nervosa are met, except that the bulimic behaviors are less frequent or have not been ongoing for long enough. Of course, we can also find such problems as purging disorders, or also such problems we can meet sometimes in young women, but also older women, night eating syndrome. And now I would like to move to the conclusion. Especially I will read this conclusion because they are kind of the summary of my presentation. At first, it's very important to stress that eating disorders concern mainly young people. However, the problem of eating disorder is increasing in the group of the older people, and particularly in women, as I mentioned previously. And the problem is increasing. Next point, eating disorders disrupt an individual mental and social life for many years and have severe consequences, as I mentioned before. Another important point to underline is that menopausal women and those undergoing puberty have higher risk of developing eating disorders due to marked hormonal changes. Another kind of the controversy or open question, which was also mentioned before, is whether presentations of eating disorders in middle age and older women represent a continuation of a lifelong illness or late onset of disease. And another important point is that complexity of physiological and environmental factors leads to an increase in the morbidity of eating disorders. Now we can respond also for the question, what are the most dangerous effects of eating disorders in older women? Is the decreased bone mass density and decreased mobility. Special attention needs to be paid to endocrine problems, neurological problems, cardiovascular problems, gastrointestinal problems, and hematological problems. And the last point regarding the treatment is that treatment of eating disorders is complicated, is challenging, but multidisciplinary. The first point is reserved for the psychotherapy, but also other tools like nutritional support, social support, and pharmacological treatment also can be considered. Thank you very much for your attention.
Thank you very much, Professor, for a fantastic speech. And we continue with the next activity here in this webinar from the European Menopause and Andropause Society, that are our polls. The method to participate is very simple. It will appear a pop-up on your screen, and you will have a few seconds to select the correct answer, and after each question we will tell the correct answer. So here is the first one. And here are the results from our first question today. The most common eating disorder in older women is 10% of our attendees answered the option A, anorexia nervosa. 10% of our attendees answered option B, bulimia nervosa. 70% of our attendees answered the option C, binge disorders. And another 10% of our attendees answered the option D, other specified feeding and eating disorders. In this case, the correct answer, it was the option C. We continue with our next question today. Here are the results from our second question today. The most effective therapy for anorexia nervosa in older women is, there were no answers for the option A. 91% of our attendees answered the option B, psychotherapy. 9% of our attendees answered the option C, pharmacotherapy, and there were no answers for the option D. In this case, the correct answer, it was the option B. We continue with our last question today. Here are the results from our last question today. Anorexia aging affects following percentage of women older than 65 years. 42% of our attendees answered the option A, from 5 till 10%. 42% of our attendees answered the option B, from 16 to 20%. 17% of our attendees answered the option C, from 32 to 42%, and there were no answers for the option D. So in this case, the correct answer, it was the option B, from 16 till 20%. And we continue this webinar, and I would like to ask our attendees that if you have some extra question for our speaker today, Dr. Meczekalski, that you can leave the questions using the question function that you can find in the control panel. And in the meantime, I would like to ask Professor Meczekalski if you have something else that you would like to add to your presentation.
Thank you, Alberto. In my opinion, I would like to only stress that this is a very important topic, clinically important, eating disorders in older women. And the conclusion from this presentation should be that we need to remember that eating disorders are not only related to the young women, because we are aware that they concern mainly young women, and this is the true, but also we need to be aware that these eating disorders, these 4 categories, particularly binge eating disorders, can also occur in older women. And it's the kind of the conclusion that we need to be aware about this clinical problem. But I also know that this topic is kind of the developing topic, because still we are searching for the to clarify the pathophysiology of eating disorders, and if we know better the pathophysiology, I'm sure that we will know better the treatment, which is, as you know, even in young women and in older women, still the treatment is very challenging and generally can last quite long.
So thank you very much once again for your conclusion. And I will ask you one more thing, Dr. Meczekalski, if you can show our last slide from Amsterdam, because I would like to speak to our attendees about our conference that will take place next month in Amsterdam.
Sorry, I didn't. My misunderstanding. I didn't, but maybe I didn't insert it. I'm very sorry, Alberto.
No worries. We can tell by voice. It will be no problem. I would like to invite our attendees today, if they are not registered for be with us in Amsterdam in our next European conference, the European Congress on Menopause and Andropause. I would like to invite them to visit our website, emas-online.org, and to register and to participate with us in our next conference that we will discuss there in Amsterdam in the Netherlands. Very important topics and very important things for the future. And also, I would like to announce that this webinar is being recorded, so the members of the EMAS Society will have access through your personal space. You can log in and enter on your personal space, and in the following days, the presentation from Dr. Meczekalski will be available. And for those ones that are not members from the EMAS Society, I would like to invite them to become members. And to be with us, of course, in our next event and on the following webinars. So once again, thank you very much, Dr. Meczekalski. It was really a pleasure to have you here today, and see you next time.
Thank you very much for Alberto, and thank you very much also for all attendees. See you in Amsterdam.